responsible for and how we should make those changes. And a lot of times we look to other people and, you know, in institutions or places and other doctors, and we get steered in the wrong direction, and I've been a part of that myself. So I'm just thankful that he's in my life. He's been a part of my life and my family's life, and he's educating people around the world. Gluten-Free Society he created for people outside of Texas, and people have come in from New York, they've come in from Ireland to see him, they've come from all over, and he's extending his time, and he's extending it even more on a Saturday, you know, for us. So I just want to honor and thank Dr. Osborne for what he does for all of us.
Thank you, Debbie. Thank you.
Just appreciate it. We have an informational table in the back. Just a lot of more information for you. He's going to be talking about the trifecta. So with all of those areas in our body that are healing, we are providing some supplementations to buy after the talk today. And if you brought a meal, if you brought a friend, I think we've given out tickets so far, so feel free to catch us if you haven't received a ticket. Also wanted to let you know that we're moving this year towards maybe the end of the summer. We're seeing the building go up. We're seeing the parking structure go up as well, right next to Costco still. I guess it's still in Sugarland, but it's right next to Costco off the Feeder and Sweetwater Boulevard, so I guess that's the university area. So we're excited about that growing space. We've all, you know, love each other so much, but now it's time to kind of stretch a little bit, and still, you know, we're excited. So we are looking at possibly giving away some items. Again, that's why you received your tickets. One of the big allergy tests that have helped patients and help family members too, just the same, because when our patients come in to see Dr. Osborne, they refer somebody and let them know that this test, the ELISA allergy test, is one of the best in the world. The reason why Dr. Osborne uses it is because he wants to get to the bottom line root cause and not try one test and that doesn't work, and let's try another test, and so on. This test has really helped patients get to environmental, food, toxic, and so that's one of the tests we're giving away. Spectracell is what we use for our nutritional deficiency. That's going to be a giveaway. If anybody has a testimony that they want to share at the end of the meeting, basically how you were before Dr. Osborne, we saw Dr. Osborne, and then after with his protocol, we've experienced, you know, some tremendous healing, and it goes so much better. If you have any testimonies, let us know. That may qualify you for a prize as well. And I think that's about it.
All right.
We are looking forward to hearing you. Thank you.
Thanks. Got too many wires and gadgets here. Sorry for the delay, folks. We have to make sure that we were able to get in online. We're actually broadcasting to about 400 people too today, so there we go.
The broadcast is now starting. All attendees are in listen-only mode.
Okay, so today we're going to talk about the gluten trifecta. The gluten trifecta. The topic of today's meeting, really I wanted to focus on three of the major issues that gluten can create within the GI tract. The GI tract meaning the gastrointestinal tract. And so the focus is going to be on leaky gut, it's going to be on irritable bowel syndrome, and it's going to be on gastroesophageal reflux disease, or otherwise known as acid reflux. Here we go. Okay, a lot of people aren't aware that gluten can cause damage in many different types of ways, and this diagram is just designed to show you the widespread way that gluten can create problems. Let me move this thing down and out of the way. So what we're looking at here, you can see gluten exposure on the top, and we're talking about people with gluten sensitivity. That gluten exposure can create what's called a primary effect. Now, primary effect is an effect directly caused by the gluten, And a secondary effect is an effect that's caused after gluten does damage. Is everybody clear on that? So when we say primary and secondary, the problem in medicine today is doctors a lot of times, they are looking at primary symptoms, but most symptoms are secondary. So they're failing to actually identify or diagnose or properly ascertain why the person's problems are there in the first place. As an example, if we look at gluten here on the secondary side of things, gluten can cause nutritional deficiencies as a result of damaging the GI tract. So we have a primary effect of damage to the gut, a secondary effect of inducing nutritional loss. Now if somebody has fatigue, right, which is a very broad symptom, a very broad kind of problem with lots of different types of potential causes, and the doctor says, oh, you're just tired and depressed, here's an antidepressant, right? That's not going to actually fix that person's fatigue. What would be a better move would be to actually go in and ascertain whether or not nutrition is sound, because if we have nutrition sound, now that person, instead of having fatigue because they're B12 deficient, right, we can now correct a B12 deficiency, or we can identify a deficiency, or we can identify that damage in the gut that's causing that deficiency. So if we look at primary effects of gluten, you've got barrier permeability. Anybody heard of leaky gut? When we talk about leaky gut, we're talking about not just leaky gut, we're talking about all the barriers that can be permeable within the body. There's a blood-brain barrier. And one of the impacts gluten has is on brain. It can cause schizophrenia. It can cause bipolar disease. It can contribute to and cause ADD and ADHD-like symptoms. And these have all been studied and well documented in medical literature, but very few doctors test for this. Very few doctors actually look at this. So barrier permeability could mean leaky gut. That BBB that you see at the bottom there stands for blood-brain barrier. Okay? But there are other barriers. There are barriers in our kidney. There are barriers in our lung. Our skin is a barrier. So gluten can cause skin disease and lung disease and brain disease and gut diseases. All these different kinds of diseases gluten can cause and contribute to. One of the other primary effects of gluten is that it can induce autoimmunity. As a matter of fact, if we look at autoimmune disease is the #1 killer in the United States. If we look at all the diseases that kill people in the United States, the #1 cause of death in the U.S. is autoimmune disease. The problem is, the reason why you don't hear a whole lot about it is because when we do statistics on disease, we separate autoimmune disease out into about 190 different conditions, like rheumatoid arthritis and lupus and scleroderma and dermatomyositis. So there's all these different autoimmune conditions, and we separate them out so we don't blame all those deaths on autoimmune disease as a whole. We blame it on these each individualized autoimmune diseases so it doesn't get recognized as well. Well, in science, we all know celiac disease. How many of you have heard of celiac disease before? Okay, celiac disease is the autoimmune disease caused by gluten. Okay, we know that gluten is the only confirmed, scientifically agreed upon universal cause for autoimmune disease. And it's not just celiac disease that it causes. That's just what most doctors are taught when they're going through school. That's what most people are taught to believe, is that celiac disease is the only disease that gluten causes. But there are a lot of conditions, a lot of autoimmune diseases that gluten can cause. Celiac, as you see there in the example, celiac as well as Hashimoto's, which is an autoimmune thyroid disease. You see AS, which is ankylosing spondylitis. There's a long list of autoimmune diseases. If you want to see that list, you can go to glutenfreesociety.org, and there is a list of all the different conditions and diseases that have been linked to gluten sensitivity in medical literature. Dysbiosis. How many of you have heard of this term before? Dysbiosis is abnormal bacteria. Okay? Now, when I'm talking about abnormal bacteria, we're talking about abnormal bacteria in the gut. You have 10 times more bacterial cells in your gut and on your skin than you have human cells. So we could make a very good argument scientifically that you're more bacteria than you are human, right? We're very symbiotic with that bacteria. And a dysbiosis is when we have an imbalance of that bacteria. In other words, we have certain kinds of bacteria that maybe they're not evil or bad or infectious, but they're overgrowing and they're creating a problem as a result of that overgrowth. Does that make sense? Okay. So dysbiosis is one of the things we know gluten can do within 30 minutes of ingestion. Within 30 minutes of exposure, gluten can start altering bacteria within your gut. Then we have acute IgE response. An acute response, a lot of people get confused on allergy, sensitivity, and intolerance. Most people use those three words synonymously, right? And so if we define the differences, an acute IgE response is an allergy, okay? It's what most people consider to be the truest form of allergy. That means within 30 minutes of exposure, a person will have severe outbreak of hives, shortness of breath, wheezing, coughing, sneezing. If it's a food allergy, they may have diarrhea or vomiting. They may have windpipe closure, right? They may have esophageal spasms. So they may end up in the hospital with what's called anaphylactic shock. Now, most people don't have an IgE response to gluten. Most people have a different kind of response. That's that next response that you see there, a delayed antibody response, which is a different kind of reaction. And that reaction can occur up to 3 weeks after exposure. And that's what makes it really, really hard to do if you're trying to keep a food log and mark down, hey, I ate this today and I don't feel so bad today, but tomorrow I feel bad. And you see how that can get really confusing, because if the symptoms don't show up for as long as 3 weeks or for up to 3 weeks, or they don't conglomerate to create enough inflammatory damage to become symptomatic, then we can get really, really confused trying to keep a rotation diet or trying to keep a diet diary. So those are the primary ways that gluten can impact us, right? And then we have those secondary effects, which is after the damage is done, we can develop nutritional deficiencies, we can develop systemic inflammation. I don't know if you guys saw the Time cover. It was a few years ago. Time magazine came out with this cover, and it was a picture of a fire, and it said inflammation, right? And it's because inflammation is thought to be the precursor of all chronic degenerative disease. When I say chronic degenerative disease, I'm talking not about every single disease, right? I'm talking about the diseases that we associate with aging. So things like cancer and diabetes and arthritis and osteoporosis or bone loss, right? So with systemic inflammation, we can get organ and tissue degradation. In other words, if your tissues are chronically being burned, if they're chronically on fire, your body has some resiliency, it has some adaptability. It's not just going to fall over and die. What it's going to do is it's going to try to adapt, but the longer the fire burns, the longer that goes on, guess what happens? The tissues eventually start to break down, and that's when we get symptoms. And symptoms are when we feel bad enough that we want to go see our doctor, and that's when we tend to get a diagnosis, right? And this is a process that can take, to develop a full-blown disease, can take 20 to 30 years. Okay. This is just a general diagram of what I would like you to understand about gluten sensitivity. A lot of people think gluten sensitivity is a disease, and they think that celiac disease is the worst manifestation of gluten sensitivity. And neither are true. Gluten sensitivity is not a disease. Is a peanut allergy a disease? No. So, but what happens if we eat peanuts and we're allergic to them? We end up with problems, right? Well, gluten sensitivity is a state of genetics. You either have these genes that will respond to gluten exposure, or you don't. And if you don't, eat gluten. And if you do, you're going to have an inflammatory response to that gluten exposure, but your body's not going to die today from that exposure. Again, it's cumulative damage over time. And I point this diagram out because you can see the different arrows. Gluten sensitivity is not a disease, it's a state of genetics. But if we ignore what our genes want us to do and we eat the gluten anyway, then the odds and the likelihood that we will develop disease become very high. And so in this case, you can see celiac disease is one of the diseases linked to gluten sensitivity. But you have bone loss and asthma and fibromyalgia, chronic fatigue syndrome, thyroid disease, psychological disease like bipolar and schizophrenia. One of the earliest names for gluten sensitivity, any guesses? Bread madness. Bread madness, and I'm not kidding. It's an actual condition. Bread madness is a form of schizophrenia, right? So when we have patients or people that have schizophrenic type disorders, gluten is one of the things we want to rule out first, right? Because it could be that the food that they're eating, that gluten, is creating a drug-like reaction that's creating an alternate universe in their brain. Okay, right? Food is a drug. Where do drugs come from? Foods, plants, etc. Food is a drug. We have to respect it as such. Rheumatoid arthritis cancer. Now, I said before that a lot of people think that celiac disease is the worst manifestation of gluten sensitivity. It's just one, and it's relative. Would you rather have cancer or celiac disease? Would you rather have fibromyalgia or cancer? Would you rather have chronic fatigue syndrome or schizophrenia? It's relative. It doesn't matter. The point is that gluten can cause a lot of these problems or contribute to a lot of these problems. And ultimately, if we can identify gluten as a culprit and remove it, a lot of these symptoms and a lot of these conditions miraculously just seem to go away. Now, I'm going to show you several diagrams because gluten sensitivity, allergy, intolerance gets really, really complex. And a lot of people get really, really confused. And I kind of made mention of this a moment ago. But this first diagram that you see here is an allergy or an immune reaction. Okay, so what we're defining here is allergy. There's two kinds of allergies. If you look at the first two boxes there, the first is acute and the second is delayed. And I said a minute ago that acute happens within 30 minutes to 3 hours of exposure. And that's that IgE response. Creates rapid chemical inflammation and histamine release, right? If you've ever had environmental pollen allergies or tree allergies, you go outside and it's a really heavy day. Boom, what happens? Your nose starts running, your eyes start itching, right? These are acute responses. If we look at the delayed side, the difference is the timing. Acute happens fast, delayed happens slow. Think of acute as if you're shooting a cannon at a rabbit. There won't be much of a rabbit left. Okay? Think of delayed as shooting a pellet gun, okay, at the rabbit. If we hit it enough times, we'll stun it, kill it, and we'll have soup, right? If you guys like to eat rabbit, that is. So delayed hypersensitivity can happen in multiple different ways, whereas an acute response is typically IgE mediated one way. Delayed happens, you see these three different pathways here? There are immune complexes. There are T cell reactions that can occur. And then there's antibody responses that can occur. They all lead to chemical inflammation. They all lead to tissue damage. They all lead to disease. The difference is in the timing. The difference is in the chemical mediator. Does that make sense? That's why some drugs work well for some people, but not for others. Some drugs that block inflammation or that block allergy responses work well for some, but not for others, because there's all these different mechanisms. And usually not one medication is comprehensive of all these. And if it were, it'd kill you anyway because it'd suppress your immune system so bad that you wouldn't be able to protect yourself. When we test for allergies, that IgE response that you see there is typically what gets tested for. It's the skin prick, right, or the patch test. When we test for celiac disease, that's typically what gets measured, IgG only. Sometimes a good doctor will measure IgG and IgA, but typically it's just IgG, right? So you see that what we're missing here and why so many people go under the radar of diagnosis. They get missed completely because they're not having an IgG response to gluten, more specifically gliadin, which is one type of gluten out of thousands of different types of gluten that we've identified. Gliadin is only one. It's the only type that gets tested for when doctors are looking for celiac disease. So the testing is extremely flawed. I want you to understand that because if you've been tested and you've been told you didn't have the problem and you were tested in this traditional way, it's very realistic possibility that you were incorrectly informed. Does that make sense? Those very rarely get tested for. And then there's intolerance. And intolerance is different than an allergy because an allergy is an immune response, whereas an intolerance is an inability to digest. Okay? And intolerance usually is a secondary effect. Remember before I showed you the diagram of primary and secondary effects? We say primary effect is gut damage. Secondary effect is when the gut is damaged, we now have damaged our ability to digest. We've damaged the cells that make digestive enzymes. So now we become intolerant to different foods. When we try to eat them, our gut's broken, it's inflamed, it doesn't work. And those foods that are supposed to be being digested by our healthy gut are now sitting there rotting inside of our gut, right? We call that putrefaction or putrefaction. And that rotting feeds the wrong bacteria. And then we have these overgrowths of the wrong kinds of bacteria and yeasts and other things in the poop of all those bugs. And the chemical byproducts of all those bugs start firing our immune system, create all kinds of immune system responses. So now we're acting like we're allergic to what we're eating, but we're really not allergic to what we're eating. We're just not digesting it. And it's the inability to digest it that's created a chemical inflammatory reaction that we start having an immune reaction to. You see how that gets kind of confusing and complex? Right? I've had a lot of time to think about this. So now, if we look at another parameter of intolerance, and this is relatively new, it's called leaky gut. So we have this inability to digest that leads to a gut change in bacteria, which leads to a leaky gut, right? But then we also have that gluten directly can bypass these two mechanisms and go straight to leaky gut. Okay, and this was discovered about 9 years ago at the University of Maryland. We can credit Dr. Alicio Fasano for making this discovery. These proteins within the gut called tight junctions get broken down by gluten, and so the cells in the gut drift apart. We get little microscopic pinholes within the lining of our gut, and now whenever we eat, the food that isn't supposed to leak into our bloodstream is now leaking into our bloodstream. And guess where we have more immune cells than anywhere else in the body? Our gut, right behind the wall of the gut. It's called the gastro-associated lymphoid tissue, or GALT. And when that tissue is overworked, it's like a soldier in the field who's been overworked. Every day somebody's shooting at him, attacking at him, his nerves are shot. What happens when he gets attacked? Shoot first, ask questions later. And that's what the immune system starts doing. It starts attacking everything, including you. And that's where autoimmune disease can come from. Make sense? Then we have this, okay? The inability to digest leads to a production of immune system antibodies and inflammatory chemicals that also cause leaky gut, that also cause tissue damage. So you have all these different whirlwind factors that are going on simultaneously, and when doctors run one test to measure one type of antibody to one type of gluten, and they're not discovering it because they're missing all of this, because they don't know that they're supposed to be looking for this too, then a lot of people get told, you don't have celiac disease, don't worry about it, go continue to eat all the gluten you want, you need whole grain in your life, it's better for you, you're constipated, you need more grain, and the people never get better. Does that make sense? They get drugs that kind of accommodate or mask their symptoms for a time, and then when the drugs quit working, they get more drugs to go on top of that, but the origin of the problem very rarely gets addressed or dealt with. Okay. So let's have a little bit of perspective. Disease is the accumulation of years of damage. Typically, we don't wake up with cancer. We don't wake up with diabetes, right? We don't just wake up. Usually, we've either neglected ourselves to such a point that these diseases have set in so that by the time we're sick and we feel bad and we've seen a doctor, it's not what we just did that caused the disease. It's what we've been doing for a lifetime. Does that make sense? The damage is a conglomeration of environmental bludgeoning. Okay, so repairing years of damage takes time. This is one of the biggest questions I get asked. How long will it take me to heal? How long can I feel better? How quickly can I feel better? 18 months to 3 years is realistic when you have an autoimmune disease and you're trying to put that autoimmune disease down. It's usually not going to happen very much faster than that. Okay, I've been treating patients for 13 years. I've seen over 5,000 patients. And it's very, very rare to see somebody have an autoimmune disease go away in less than 18 months. It takes at least that long. Now, does that mean that person doesn't feel better for 18 months? No. People usually feel a lot better within the first few months. Okay? But feeling better and being healthy aren't the same thing, right? Because what is our ultimate goal? Our ultimate goal isn't to feel better than being on death's doorstep. Our ultimate goal is to be well. Is to feel well, is to be resilient, and to have a dynamic immune system that can respond and adapt to the environment without knocking you out. So removing gluten does not repair damage any more than removing the nail from a popped tire fixes the tire. The tire's still popped. Removing the gluten or removing the nail just ensures that you're not going to have more damage. Does that make sense? So we're stopping the damage, but we're not fixing the damage that was done. Everybody got that? Stopping the poison helps, but it won't address all the other environmental factors that contribute to poor health either. And so when we talk about gluten, I don't like to say gluten is a catch-all for every disease, because it's not. but it sure does contribute to and cause and promote a lot of different kinds of diseases. And it is a major, major factor for a lot of people, so we want to respect that as well. Okay, this is your gut after years of gluten. Okay? And this is you when you are first going gluten-free. You see the guy pouring a little bucket of water on the fire? Okay? Not a whole lot's happening. You're making the attempt, okay? But there's so much damage and so much fire that at first it seems like it's somewhat an action and an infutility, right? Okay. The path to disease. Undiagnosed, typically little symptoms. I had a question. If you saw the email that went out yesterday, I had a question from one of our subscribers online. And guys, if you ever have questions, please write in and feel free. I try to answer at least one question a week. So if I pick your question, you get free advice, right? But I had a patient or a subscriber email a question. Her son was having mouth ulcers. Her husband and her daughter had already been diagnosed with celiac disease, and her son would have mouth ulcers after eating cake. Okay? And so her question was, should her son go ahead and go gluten-free, or how long should she let it go on before she made the decision to make her son go gluten-free? And of course my answer was, he needs to be gluten-free already, because he had already been tested genetically and he had positive genes for gluten sensitivity. So, easy answer to that question. When a person is undiagnosed, as this young boy was, they're typically little symptoms, small things, not detrimental, huge mountains of problems. Things like mouth ulcers. As a matter of fact, the number one symptom of gluten sensitivity, okay, in research studies, the number one predictor is a mouth ulcer. Now that's not saying that everybody with mouth ulcers has gluten sensitivity, and that's not saying that gluten is the only thing that can cause a mouth ulcer. But it should be of note that if you're having chronic mouth ulcers, maybe something you want to investigate. Progression to subclinical problems. What does subclinical mean? Subclinical means problems before they become symptoms, right? It's like the check engine light on your car. It's a problem, and if you don't address it or try to diagnose it, right, then your car motor may progress to something more problematic, okay, as far as like breaking down when you're on the highway, right? So the subclinical are the problems before they're big problems, right? And so intestinal permeability is not something we typically can feel. It's a disease, it's a condition, but it's not something that we necessarily feel happening. You don't feel leaky gut. Acquired food and environmental allergies. People become more and more allergic to the environment, including food, the longer they have leaky gut progression. Okay? We basically lose our immune system's adaptability. And remember what I said about the soldier? It's like the soldier, it starts attacking everything, okay, including your food, including the environment, so you become a hyperallergenic person, okay? And then there's the recognition of the problem, but not its origin. And that by the time you get to illness and disease and you're in your doctor's office and they say, okay, Mrs. Jones, you have irritable bowel syndrome. We really don't know what causes it, but if you take this drug, you'll feel better, right? Now, I'm not against medicine, and I don't want anybody to walk away thinking that medicine is bad. I think we have the greatest medical care in the world if you have an acute condition. But if you have a chronic disease, we have the worst care in the world because we don't look for why, right? But illness and a disease is really not an illness and a disease. If we think about this philosophically from a different perspective, and I want you all to open your minds and think about it a little bit differently. When you have a problem, should we say, poor Mrs. Jones, you have a problem, here's a drug to fix your problem? Or should we say, Mrs. Jones, your body is trying to tell you you're doing something wrong, and it's not really a disease, it's your body's way of communicating with you to change. And if we suppress that communication, all we're going to do is give you a false sense of security. You may feel better for a time, but the disease, the underlying issue, the origin of the problem is going to continue to fester and manifest until it gets out of control, and then you end up with something worse. Does that make sense? So think of disease more along that line than you would on, hey, I'm going to take this acid reflux medication because my doc says I have acid reflux. Why do you have acid reflux? Why do you have IBS? Why do you have leaky gut? Does that make sense? Now, I said before I didn't want to blame gluten on everything. Disease is always multifactorial. In essence, gluten can cause damage and create problems, but there are usually other factors too, right? How do we know this? Because you can take patients who have celiac disease. Some of them get diagnosed as wee little lads, right? Or little tiny toddlers at birth. Some of them it takes 30 or 40 years to get a diagnosis. There are other factors involved to the progression of these diseases. Although gluten may be a central contributing factor, there are other factors as well, lifestyle factors, genetic factors. Once you become ill, healing may require more than the removal of gluten. Toxic burden impacts the function of multiple tissues in the body. So by the time you've got all these fires that are raging on and you've taken the gluten away, let's say the fire is burning long enough and your liver's damaged, right? And you're getting exposure, because you live in Pasadena, you're getting exposure to all these different chemicals, okay, through the air, but you have a damaged liver, so your body's not as good as it used to be at processing those chemicals. So now you're in a weakened state and you're having a hard time making a recovery, not necessarily because you haven't gone gluten-free, but because you've got the damage from the gluten that's still persisting and hasn't been addressed or dealt with. Does that make sense? Now I want to show you guys some things, because the number one excuse I hear from doctors or from patients who have talked to their doctors about this is the doctor will say, there's no research that supports that, okay? I can't tell you how many times I hear that. There's no research, there's no research. I'm like, what research are you reading? Because I'm on the National Library of Medicine's website right now, and I just did this morning, and you can see when you type in and you do a generalized search for gluten and intestinal permeability, which is the medical term for leaky gut, okay, you get 207 research studies. There's no research. There's 207. Why don't we start with reading those? When we talk about acid reflux, and realize acid reflux is actually a bad search term. If we type in gastroesophageal reflux disease, Barrett's esophagitis, okay, we could use other medical search terms and we'd pull back up even more articles. But just typing in acid reflux, you get 24 research studies back on the correlation between gluten and acid reflux. If we type in gluten and IBS, we get back 58 research studies. It's not a lack of research, it's a lack of knowledge, okay? And today, fortunately, we're in the age of information. You can get access to information instantaneously through the internet, and your doctor can do it too if he's willing to. So if your doctor ever tells you there's no research, my advice to you is do your own homework, bring it into your doctor and say, doctor, I know you're going to tell me there's no research, but what do you think about these 58 studies? Can you render that opinion, and maybe we can set up a time to talk about it? I mean, seriously, if your doctor's not going to talk about it with you, who is? Right? You have to have a doctor who's willing to communicate this to you, who's willing to learn. I'm not saying that these doctors, because they don't read all these studies, there's no way we can read them all. I mean, there's over 80,000 medical journals that are peer-reviewed. I don't read them all. There's no way anyone could. But the fact of the matter is, doctor means teacher. Teacher means student, right? And as a doctor student, you're always willing to learn on the behalf of your patients to help get them better. So you need to have good relationships with doctors who are willing to learn and not just sitting back idly. Okay, remember I said it's gluten, but it's not just gluten, right? So there are other toxic exposures that we can get a hold of that are going to contribute to this trifecta.